Marijuana use impact your fertility? Hello, I'm Dr. Samantha with Walk the Natural Path. I am a naturopathic doctor that treats fertility the natural way, and today we're going to talk about marijuana, specifically THC, and how it impacts fertility. Hi, so welcome back to my channel. If you didn't know already, I release a new video every single Friday, so please hit that subscribe button so you are aware when those are released. But for today, we're here to talk about marijuana and fertility. So first, I want to make a disclaimer that we are talking about THC. This can be a pretty controversial topic. One, people don't like when I am talking about removing substances from their life, but two, people also get kind of upset when I say marijuana and I don't clarify that it's THC, not CBD, because CBD can be used in many medicinal ways to actually help fertility. So I'm just making it very clear that we're talking about THC. So if you have CBD gummies or CBD drops that help you relax or sleep, or you use it in the bathtub, that's not what's harming your fertility, it's the THC. So I'm glad that we have all of that aired out. For my practice with my patients, I have done a lot of research on marijuana, THC, CBD, and I have come to the conclusion that marijuana shouldn't be used once a week or once a day. Basically what that means is when someone's trying to conceive, I think it should be eliminated during that time period. I have many reasons why, and I'll list those in a second. If you're still feeling upset or marijuana is being misunderstood, if you have articles that say it doesn't impact fertility or that there's no actual evidence, I'd love to see them. Majority of the information that I have seen and read has pointed to these conclusions. So without further ado, how can marijuana impact your fertility? Well, for starters, it impacts male and female fertility. So we're going to talk about for males, if it's one, used chronically, or two, used occasionally. So if marijuana is used chronically, meaning every day or many times a day for an extended period of time, that can impact males in a hormonal fashion, meaning it can actually decrease your testosterone, which will decrease your sperm count. If it's used occasionally, so maybe once a week, that can lead to more issues than I think people even realize. So what are some of those issues? It can change motility and morphology of the sperm. Motility and morphology are the shape and how they swim, whether they swim forward or backwards or around in a circle or whatever. We want them to obviously swim forward, so we want good progressive motility. Acute use of marijuana can impact those. It makes sense because we have motility and morphology abnormalities linked with environmental toxins. So again, marijuana impacting that makes sense. Marijuana exposure can also impact the actual genetic code within the sperm. What does this mean? It means that the actual DNA that sperm is carrying to egg can be impacted, and that can be either better or worse, and we want obviously the best genetic code to get to the egg. If it's not good DNA, it can actually lead to other things occurring. One, it can lead to miscarriage or loss, and two, it can actually lead to your future child or baby actually growing up with some developmental issues. That's a very big, bold statement, and there is just more and more research that is starting to support any epigenetic changes, which means changes in DNA or our genetic code due to environmental exposures lead to developmental issues or chronic disease later on. For example, many people don't know what causes endometriosis, but they think that the root cause is epigenetics, meaning how your mother or grandmother treated their bodies or systems, or father, could lead to your genetics now having a predisposition to having endometriosis. So that's a whole nother rabbit hole, and it can get really confusing. But I feel like when I just say, oh, marijuana can cause miscarriage and developmental issues, I kind of have to explain that a little further. And so I just did my best to put it simplistically there. So in summary, occasional use of marijuana can lead to motility and morphology abnormalities, as well as impacting overall genetic integrity, meaning there can be possible DNA fragmentation. So for females, how can marijuana impact? One, again, increasing the risk for loss or miscarriage. There is suggestions that it does impact egg quality, that however is not 100% known. However, we're seeing that if it impacts motility and morphology in sperm, it is an environmental toxin, so like other environmental toxins that hurt egg quality, we're making the assumption that it possibly does that as well. It can also decrease the chance of women ovulating. So there was a study done that was showing that those who use marijuana did not ovulate as regular or missed ovulation more so than those who did not. There's also some studies that claim that it took a longer time for those who smoked marijuana to get pregnant or to conceive. And it's also been shown that there is a lower live birth rate when it comes to marijuana users versus non-marijuana users. I did also forget to say this earlier, but there is also increase for placenta insufficiency. So all in all, I know there are people that will say, well, I knew this person who smoked marijuana every day and they got pregnant and they have a healthy baby and everything's fine. There are definitely outliers, and this is just one of these messages of saying, like, why risk it? Why do something that's making it harder while trying to conceive? Let's just stop this for this period of time, and then after, if you want to start it back up again, you know, you have to do what's best for you and your family. But ultimately, this is just a message that is just showing you what could happen if there is chronic or occasional marijuana use even. So it's one of those cases of please don't shoot the messenger. This is just what I have seen, what other fertility docs have seen too. And I hope you did learn something new today. If you have any questions or comments, please put them down below. And then please give this video a thumbs up if you learned anything new today, and have a beautiful rest of your day.